I really loved medical school until I hit the wards. And then I was super anxious and I had no idea, it was terrifying for me. I wasn't expecting that.
Apart from just having general stress and anxiety, there's a real sense of dread of waking up in the morning and, going in to do something that you used to love and now you don't love it anymore.
We tie our own worth or value as human beings to this achievement or this productivity treadmill we're on. And it's very hard to separate that.
Hello and welcome to another episode of the Next Step podcast. I'm Jeff Kozlowski, your host. Since May is Mental Health Awareness Month, we wanted to have sort of a special episode talking about that topic and specifically burnout in the medical field, in the research field. Today we have Amber Rivera, who's our Director of Learner Life and Wellness for Graduate Education and Postdoctoral Affairs at the School of Medicine and Dentistry, and Karen Leitner, who's an MD alum from 2002, now a leadership and wellness coach for women physicians. Amber, I know I gave a brief intro there for you at the beginning, but do you mind telling us a little bit more about what you do here at SMD and how you help our trainees?
Sure, and I'm really happy to be here today. Thank you for inviting me on the podcast. In the Graduate Education and Postdoctoral Affairs office, I'm so thankful that they realized the need for a role for wellness. So I am Director of Learner Life and Wellness, and so I bring awareness to our trainees about their mental health, stress and anxiety needs, personal wellness. I do some programming around those areas. I also meet with trainees one-on-one, especially when things are overwhelming and they're not quite sure what resources are available to them. A big part of my job is connecting our trainees to mental health resources within the university, outside of the university. I'm also a trained social worker with 20 years experience in social work, and so I can help respond to crisis interventions when things are really overwhelming and serious problems arise with our trainees. I can help assist with that and make sure that everybody has the support and the resources that they need to be able to get through those things.
So, Karen, I want to break your introduction down maybe into a few different parts because I want to first focus on you having all intentions of being a lifelong physician. Went through medical school here, did a residency, was actually working, went and worked in a medical practice, and then switched career paths. So can you sort of take us through that journey a little bit?
Sure. So, one of the things that drew me to U of R for med school was the biopsychosocial model. I'm sure you've heard about it a lot. But I love the idea of just understanding patients, and I just wanted to be super kind and help people. That was really my focus. I wasn't thinking about my life or myself. I just thought that would be fulfilling. I want to do that. And I really loved medical school until I hit the wards. And then I was super anxious and I had no idea, it was terrifying for me. I wasn't expecting that. And I went to a therapist, but I just sort of thought oh, this is just how it is. And then in residency, it really got even harder for me to manage. And I didn't really understand. I didn't feel like I got the support for my mental health. I would mention it to a few people who I considered mentors, but I just sort of felt like it was oh, yeah, there wasn't a place for me to bring that. And I think I had a lot of shame about it. So when I finally graduated it was really challenging for me, not the medicine part, but just I think I probably was depressed in my residency and very isolated. And I later found out I had ADHD, which I had no idea. So all these things were going on. I got my dream job. I finally moved back home. I met my husband. Everything was exactly the way I had wanted it to be. And then over the next several years, I had my kids, and I felt like I was bursting at the seams, just sort of drowning in all the work, all the responsibility, all the worrying about if something bad happened to my patients, doubting myself, spending a lot of time on the admin work, doing primary care, all these things. It was a perfect storm. And I had no sense of why it was happening. I had no language for it. I didn't know burnout was even a thing. And I want to kind of be careful because burnout in the WHO definition is sort of different than how we use it in the colloquial, way we talk about life in general. But so I left And I thought it was me. I thought, I guess I just couldn't handle this. And it was very devastating to me, actually, but I felt like it was survival. I just had to get myself out of there. And I worked in a whole bunch of clinical kind of roles part time. I thought it was just the job. Oh, this job isn't right for me. And then eventually one day, to make a long story short, I heard a coaching podcast that was talking about how your thoughts create your feelings. And that idea, I was like, what? Like, some of why I experience things differently is because I think differently than other humans. And I went down a long journey of trying to understand how my thoughts were contributing to my experience and why things felt so frustrating and hard for me and overwhelming. And that sort of led me, it was a coaching podcast. It led me to just want to learn more and finally enroll in coaching certification. And during the pandemic, start to help other physician women learn these tools. It's actually a skill set. It's not sort of like a mentorship or I know what's right for you. But the things I uncovered, just to break it down, is, perfectionism was a huge part of what was giving me a lot of distress. People pleasing, just sort of putting other people's needs ahead of my own, over self-sacrifice. These are all things that the culture of medicine and advanced, academia, it's in the water, it's in the air we breathe. Learned helplessness, imposter thinking, being super self-critical, all these things play a role in making things hard for us. And it's universal, and there's a lot of shame in talking about it. So one of the things that I've really enjoyed since I've become a coach is just raising awareness of all these things, right? The need for better mental health, the unmet needs of people in higher education. And, this isn't specific to doctors. It's just my experience, my lived experience. But the more we talk about it, the more we humanize all of our lived experiences. Like, I was joking, but I almost didn't come to this call today because I had it on my calendar wrong, right? How shameful is that? Oh, you miss a professional meeting. It's like, no, actually, we're humans and this just happens. And you guys are humans and you have lives and families. And isn't it crazy that we can actually just sort of accept that about each other instead of thinking we have to live to some perfect standard? So that's a lot of what I do for these women I help now.
Love it. So, yeah, and you mentioned, here we are talking about it, which point of, or one maybe point of Mental Health Awareness Month is being comfortable talking about it. When I first started at U of R, one of my first articles I wrote back in 2021 was on physician burnout, and one of our Dr. Epstein, a professor in the Department of Family Medicine.
Oh, I know him.
Here at SMD.
He was there when I was there.
Okay.
He's been around a long time.
In the article, he mentions part of the culture of medicine is a culture of invincibility. Physicians are resilient, but reluctant to ask for help. When we're suffering, we do it alone, and in silence, we need to make more public that physicians too suffer from anxiety, depression, and post-traumatic stress. So glad, for all the more reason to do something like this. Amber, in your discussions, with some of our graduate trainees and postdocs, what are sort of signs? Like, how does somebody know they're experiencing burnout, or like what is it? What are the things that are happening where somebody might be able to be like, oh, maybe I am experiencing burnout?
Yeah, I mean, apart from just having general stress and anxiety, there's a real sense of dread of waking up in the morning and, going in to do something that you used to love, and now you don't love it anymore. You're dreading it. That's a real sign of occupational burnout. And I think it's important too that, we use the word resilience, and there is this culture of expectation that resilience means that you're going to go until you completely drain yourself. And I'm curious, Karen, if that was your experience too, that, doctors are just supposed to have resilience and grit, and they're supposed to rise to the occasion for every failure. But there's that overall message, but not a lot of support for the mental health the mental health that it takes to be able to rise to the occasion and to have that resilience.
Yeah. I mean, a lot of doctors hate that word because it's like, does resilience mean you thrive in a system that doesn't support you and is actually trying to
Right.
kill you? So I agree. I think we are. And all of the students I'm sure that you work with are very resilient, but there's also, we're human. We have limitations. That doesn't mean you can go
Right.
indefinitely. And I think it can be used against us sometimes.
Yes.
I'll just offer one tiny difference. The definition of burnout that I use that is from the WHO. It has three characteristics. So one is emotional exhaustion. I think for sure the dread for me was like huge, but that can also be anxiety, that could be depression, that could be lots of things. And it's really distressing to feel that, right? To live your life. We talk about like the Sunday scaries and you're showing up or you're giving that talk and it just feels like, oh, it's a terrible feeling to experience. Emotional exhaustion, depersonalization, which is sort of like, nothing I do even matters. Like, what's the point of everything? Like, this is futile. And then loss of empathy, which if you're a caregiver, a healer, that also, then we judge ourselves. It's like, what's wrong with me? I don't feel the same connection or desire to heal as I used to. And we use like, it's very jarring to experience that, I think, when you're in healthcare.
You touched on too, like, there's cultural, like Amber mentioned ahead of this, that and Karen, you touched on it, all of sort of the outside things that come into our lives, as far as like there's cultural pressures to do well, family expectations, comparing ourselves to others. I mean, is it, realizing that we're human and these things are normal, or how do we handle that?
I think that's a great place to start, is realizing that we're not the only person experiencing that. I think it can be so isolating because the messaging is be perfect, strive, get an A, get a Nobel Prize, get that fellowship, get that grant. It's like that's sort of dangled in front of us, and somehow we tie our own worth or like value as human beings to this achievement or this productivity like treadmill we're on. And it's very hard to separate that from your own sort of internal way you talk to yourself, way you validate yourself. So that is such a great question. I think for me, what I end up finding so valuable is helping people appreciate, first of all, I am not my job. It doesn't define me. I can have a great day at work. I can have a terrible day at work or in school, or I can do badly on a test. It doesn't mean I'm bad. It's like separating our achievements from who we are. And then self-compassion is being kind to ourselves, understanding that there's a universal experience of all humans. So when I got a C in organic chemistry before I went to med school, and it was like the low point of my life, right? I thought my life is over. I'm never going to be a doctor. Everything's going to be horrible. And then you sort of reject yourself. What's wrong with me? I'm terrible. Why do I even bother? Like, I'm a failure. I had this professor who was so kind to me. And you just realize, like, if you can direct some of that towards yourself, oh, this happens to everybody, and I don't have to make it worse by telling myself horrible things about myself. You have to start at the very beginning with an awareness of how you're thinking about yourself. And most of us have no idea. We're just completely unaware. And for most of it, it's super negative and super critical. So even just realizing like, oh, that's not very nice. Like, ow. Like when you just said, and you're going to fail and you're going to live under a bridge, like actually, ow, that hurt me inside. We want to sort of, that's what we do a lot in coaching, is start to recognize some of these thought patterns and realize we can actually shift them. And when you do, you actually do even better. We sort of think I need to beat myself into performing. It turns out when you exercise and sleep and eat, and if you're in healthcare, like go to the bathroom when you have to, like you actually do better for the people you're taking care of. But also, it doesn't work to beat yourself into performing. You just wind up really unhappy. And I think that's what brings a lot of people to you, Amber, is that's what we're told we should be doing. So it's very mixed messaging, like take care of yourself, but get all A's, but exercise and eat healthy. It's like there's so much room for us to judge ourselves as failing. But I don't know. I think there's a lot of nuances to how perhaps the system itself in education could message things differently. And for sure in healthcare, this is not a human problem. This is a system problem, which we could talk about another time. But most of this is the system problem. Like, it's not just that physicians or healthcare workers experience mental health disorders as much as the general population. It's that the work we do predisposes us. We see trauma. We see awful things every day, all day, and we hold that inside of us. So it causes it. And then we somehow think we're weak if we need to get help or ask for help because we're supposed to identify as the healers and the rescuers. So it's very messed up, complicated, but not insolvable. But we have to start to look at like, what are the institutional ways that it's a symptom of something bigger than us?
Right. And that self-compassion, I've actually been surprised a few times in talking with our trainees in research. how new of a concept that is to
Yeah.
them,
No
because
idea.
because constantly comparing yourself to all these external factors, and then sometimes for some of our trainees that have that as built into their family culture, their parents are putting a lot of pressure on productivity and accomplishment, and the thought of having their own identity around it that doesn't rely on what everybody else thinks about them. The thought that what they are feeding to themselves in their own mind is very, very impactful and important is such a novel idea sometimes to people who are really, really struggling with that comparison.
There was no self-compassion day in med school that I remember,
Right.
right? There was no take care of yourself day. I mean, it was a long time ago. I hope that things have changed, but um, that didn't exist. And I think it's so important.
Grad school is challenging enough. Let MyHub give you a hand in planning your career and professional development. Need CV help? Grant writing tips? LinkedIn upgrade? We've got you covered. From one-on-one career coaching and writing support to wellness resources, mentorship, and fostering your professional network, MyHub is your partner every step of the way. Not sure who can help? That's what we're here for. We'll connect you with the right people and tools to move forward with confidence. You don't have to do this alone. Visit myhub.urmc.edu to learn more. Karen, you gave me some homework ahead of
Yeah.
this
Did you do it?
discussion. I did. I started it.
Yeah, that's okay. That's fine. It's a very simple concept.
Yeah. So Karen suggested ahead of this conversation that I read a book titled The Gap in the Gain, and I've started listening to the book. And yeah, that, you touched on it a little bit, but it is truly amazing. It sounds like, how we tend to just look to the next thing, and it's so easy to forget all of the success that we've had leading up to any particular point, and it's a shame that we find it so difficult to celebrate that. um, One thing that's mentioned in the book, and one of the authors like tries to end his day by listing out 3 wins, from like how, and it sounds small, but like how impactful is stuff like that, Karen?
Now you're preaching to the choir. I mean, the thing is, like, we are wired to look for the thing we do wrong. If you've ever taken a test and you get like 98% right and you get 2% wrong, you're like, why? Instead of looking at the gain is from where you started or the things you get right, and the gap is what we don't get right. So it's part of probably what evolution put in front of us so that we're always trying to better ourselves, or we're always trying to keep going. Otherwise, we would just lie down on the floor and not do anything all day. But so in coaching, we're also talking about neuroplasticity, which is like the pathways our brains like to go. So for most of us, we spend our whole lives habituated to looking at the gap, and it's survival, right? You're like, oh, most things are safe, but like there's an alligator. So we're looking for that. So when you teach yourself, instead of going through a day and then looking at all the mistakes you make or all the problems you had or all the things you wish you had done better, when I'm teaching people, this is like such an easy thing, but whenever you're evaluating anything you've done, you want to start with what went well, because our brain just goes right past that. And when you don't notice what went well, then it's hard to iterate and do that again. So you're missing an opportunity to like improve. But we start with what went well, then we look at what didn't go as well, and then we look at what would I do differently next time. That is a guaranteed way to like continue to improve. So when you're getting through your day and you're forcing yourself to look back at a few things that went well or that you feel proud of, you're starting to create a new neural pathway. And I think of it like a river. Right now the river of I did lots of things bad is so deep, but the more you practice a different path, then your brain starts to naturally start to notice that more. So neuroplasticity is fascinating. It's not just, maybe there's some scientists who could explain it to us better that are listening to this podcast right now, but it absolutely works, and it can work for gratitude also. That's a different kind of rethinking or different pathway, but there's a lot of evidence to show that it really does help increase like self-efficacy and happiness, which is what we all really ultimately want.
Right. And putting that practice into place so it becomes habitual in times of low distress is so important. So that way, when you are in times of distress, you don't have to reach so far for that practice. It's
Yeah.
really the habit.
Yeah. And the same with self-compassion, right? Like we're usually
Right.
pretty kind to ourselves-ish when things are going well, but when things get really hard, that's when we just start to be like, we
Mhm.
just lay on the negativity. So having that ability to notice and to redirect is so beneficial.
When I mentioned the Dr. Epstein article a little bit ago, and when I wrote that, it was 2021, and COVID was still very much a thing, and obviously still is, but we're sort of in the midst of it, and it was at the time raising more awareness to the fact that physicians are not immune to mental health or to mental illness. It produced greater isolations. The hallway conversations that happened were no longer happening. Lunches, all that stuff suddenly ended. Have come out of that. But Karen, I'm curious, like in your work with the physicians you work with, is that still does anything like that still kind of have an impact? Has it left a scar? Like, are physicians truly getting past that even? Like, or how impactful was just going through something like that?
Well, I think the post-COVID healthcare system is really struggling. And so the burnout and the mental health struggles of physicians, no, it's gotten worse. Like every year there's a Medscape puts out a suicide depression report for physicians. I think it's just depression now, not suicide anymore. But you look at the numbers, hoping every year I look at them, hoping they're better, and they're not. And it's what I haven't compared, and which is still really worrisome to me, is I think what you're asking is there some more normalization? Is there more people talking about
Hmm.
mental health? And I think yes. Like I think that we are trying to have more conversations, and there's this idea that wellness is important and that taking care of yourself is important. I think there's still a lot of like, how am I supposed to do that? But what you're raising too is there's literal stigma, not only sort of, oh, it's I shouldn't, I should be tough and I shouldn't suffer from mental health. There's fear of retribution. There's fear of losing your license. And so I'm an ambassador for the Dr. Lorna Breen Foundation. I don't remember if we talked about that when we spoke before, but she was a physician who died by suicide in the pandemic, who had, really bad COVID and then went back to work probably too soon and then had a really serious mental health crisis and just didn't recover. So the work that her brother-in-law and sister are doing now is trying to actually change the laws according to the state medical boards, because a lot of those laws asked intimidating and stigmatizing questions that still to this day a lot of physicians think, if I see a therapist, if I talk to someone, it's going to affect my ability to practice medicine and my livelihood and my ability to get life insurance and all these things. So again, it's like institutionalized, that hasn't changed per se, but the Lorna Breen Foundation has gone from, I think there were like 18 states that had non-stigmatizing questions in, like when I first started giving talks in 2020, 2021, and now there's 30 states that are incorporating, are you taking care of your mental health? That's what we want to see, not you should be afraid to disclose that maybe you talked to someone sometime. And then there's also no evidence that people who have gotten mental health care provide worse health care. Like if anything, you want your doctor to be mentally like helped and supported. So I would say the problem has gotten worse as the resources and the post-COVID staffing issues and all the, institutions are in the red and financially. And then there's this huge problem of the corporatization of healthcare, which is a whole other topic. But I also think there are things, more talking about it, more action being taken. There was the Lorna Breen Act that was passed in 2021 that was like $100 million to support mental health and well-being in people in healthcare. So both, right? Both
Yeah.
and. It's like yes and no. It's gotten
Yeah.
worse, but there's also, I think, a reason to have hope. And even just being on this call with you both today gives me a lot of hope because we're talking about it.
Let's talk now. I know we have a few minutes. Karen, you specialize in helping women physicians specifically. I want to focus just on maybe some specific issues that maybe are more specific to women physicians, and it also, Amber, you've seen this too on the graduate education side, and in speaking to some of our trainees. I know, Amber, there's an example that kind of you wanted to share of. I think it was a woman who was a resident turned researcher. Can you just kind of share some of her experience?
Yeah, and I'm sure this will sound familiar, but I was talking to one of our trainees who was a surgeon before starting some research here at the University of Rochester. And the way she described research, long days in the lab, was it felt like a vacation compared to the pressures of residency, and especially being a surgeon and being a woman in kind of a male-dominated field. So I'd love to hear more about the work that you do with women in those situations, because we do have some trainees that may be listening that can very much relate to that.
Where do we start? Well, one of my most popular, like, I experienced this when I was in my work, and then I mentioned it on social media, and it got people come still to do my program. They're like, "Oh, I heard you mention that." I used to go to Starbucks and see people working in Starbucks and wishing I could do that job, because my job felt so overwhelming, stressful, high stakes, responsibility. We are so attached to that identity as a healer and a physician. And then one other thing they never sort of teach you is that you're going to make a mistake. Because you're a human being, and how do you live with that? Or one of your patients is going to do badly, and how do you live with that? So that just adds a whole other level of like stress and turmoil to taking on that role. So yeah, working in the lab is a vacation, because no one's going to die if you break like a test tube. The stakes are so high, and then we aren't given the skills to really learn how to manage those emotions, and we're actually told like don't have feelings indirectly, right? I've had lots of people be like, don't cry when you lose a patient you really cared about. Like, that is not desirable, because when you stuff these feelings down, they're going to go somewhere. And I really love Brene Brown's work and how she talks about that. But I think speaking to physician women, or women in general in academia, and women and people of other marginalized identities, it's like the paradigm was not designed for us. Like, residencies used to be all men and they would live in the hospital. That was why it was called a residency. And they had oftentimes a wife at home. Like, these are heteronormative stereotypes. And so again, like, the system doesn't support. Part of why I think I went through burnout is like, where's the role for like the nursing mom, the pregnant mom, even, maternity leave and things like that. The system expects us to bounce back and to just figure everything out, having meetings at 6 a.m. and surgical schedules. And so there's a lot of entrenched gender discrimination, I would say, in the way the system is set up, not to mention the way people treat us. And so when I talk about imposter phenomenon, part of it is this being in the gap, comparing yourself to others instead of just looking at yourself and comparing yourself to yourself. But look at like gender pay inequity. And then, not only like are women paid 20 cents less on the dollar compared to their male counterparts, but if you're a woman of color, or if you're, transgender, something like that, it's like we just see we're messaged that you are inferior. You walk down the hallway and you see all the pictures of all the past chiefs of the department. They're all white men. How is that not supposed to affect how you see yourself, how you show up? So there's a lot of challenges. Sometimes people say to me, "Why don't you coach men too? It's hard to be a man in medicine." And it is. And I think there's a coach for everyone in every field. Like, I really believe everyone should have a coach. But from my lived experience, and then from talking to so many women, we're getting it on all sides. We're getting it when did you read the book by the woman? Oh, I'm going to forget her name, but she won the Nobel Prize for the messenger RNA and eventually developing the COVID vaccine. And she was like denied an office space, and they were throwing her equipment away. So like, being a woman and a male in academia is really hard. And in this environment, especially right now, when we're sort of stripping protections around what makes things extra challenging. So yeah, you have to have your people, have your own back, advocate, and not use like internalized patriarchy against yourself to keep yourself not feeling good about your value and what you deserve and how you should go about asking for it. I could just go on and on and on. Thank you, Amber.
I also want to touch on before we wrap up, this podcast does a lot of times focus on career journeys. So Karen, I think it was a LinkedIn post I saw from you where you mentioned the path from primary care to coaching wasn't one you expected, but a reminder, and I love this, that there's no single definition of success in medicine, and you have kind of redefined that success for yourself. Can you just sort of talk about coaching, how you got it, how you built your business, and how that's been sort of a nice like transition for you instead of, like, okay, physician wasn't for me, but here I am coaching those that I was once in their shoes.
Um, yes, the thing that you just reminded me of first is that success doesn't happen without failure. And I think that's
Mm.
also something we really forget. It's like I failed a ton. I mean, so people say to me, "Oh, you left medicine and you built this successful career." It's like this was survival for me. So I think for people and when you are an overachiever and someone who excels in learning, failure is like what you think you need to avoid at all costs. And I just want to encourage everyone that C in organic chemistry taught me so many important life lessons. And all the other times I didn't get things right. Like we have to live bigger. We have to be more comfortable and normalize failure, especially even in medicine too. Like mistakes are going to happen. Let's learn from them and let's not reject people and like ostracize them. Um, so I think failure is really important. I think it's important to differentiate between success and happiness because you can be very successful and really unhappy. And so I was just coaching someone yesterday on the balance between her work ethic. She was very focused on having a high work ethic. And I was like, but what about your life ethic? Like we have to have both of those or else we are not healthy and we don't thrive. For me, I would say I I do there's a book called Quitters by Annie something. I can't remember. She like I think is anyway, it talks about how the people who climb Mount Everest, we hear about the ones who experienced tragedy because they kept going when the weather got awful. But we don't hear about the people who turned around and came down and who are still alive and who are still so sometimes I think it's okay to ask yourself, is this really what I want to do forever? you know, there's this sense, at least where I trained, where you would go to grand rounds and you'd see these little like 90-year-old physicians who've been doing it for their whole life. And we think that is success. That's what I need to aspire towards. And I think in this day and age, you can pivot. You can do other different things. You can look around for other possibilities. There's not only one right way to live your career path. And I think in my practice too, when I was going through burnout, I looked at my peers who were much older than me and I just thought, why can they do this and I can't? And when I really asked them, at least the women, the men, I don't know if it was the same, but the women were like, no, I took time off. I did this, I did that. And then I got divorced and I was a single mom and I had to do part-time. It's like at different points in your life, you can do different things. You don't have to try to do it all at once. But I think sometimes listening to that voice inside of you, if it's like so many people stay in medicine and they don't really want to be there anymore because they think that's where the learned helplessness comes in. Like, I can't do anything else. And this, I have to, and I have loans and blah, 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 which is important and significant. But I just love the mindset piece of thinking, I am smart, I am capable, I have this incredible training. And I can go find a place where I'm happier and more fulfilled and where it's valued more if I'm in a place where that's not the case. And I think when you're a student, it's the same thing. It's like, you don't have to keep going just because your parents told you you had to, right? At some point, you have to choose you over everyone else, or, and a lot of times it's this perceived rejection we're going to experience if we do something different. And in reality, it's not always the case. But so I just think, yes, being open, talking to lots of people, realizing there's not only one right way to do this. Your life isn't over if you thought you were going to do one thing and now you're going to switch. I also read at one point there was a woman who like started ice skating in her late 40s and was like in the Olympic ice skating for like 70-year-olds. Like I love that idea that you can always, tomorrow, you could decide, Jeff, you want to become a linguistics professor, like go for it in Antarctica or something. Like you only have one life. So I
Yes.
think you should try to really make it the best life for you that you can. And that doesn't always mean following this straight and narrow path that someone else created.
I love it. So, if there's one thing to take away, I know, we mentioned throughout this episode, this is a much bigger thing than we can solve in this podcast, but it's important we're talking about it. We talked about normalizing the importance of getting care or talking about it, small mindset shifts, acknowledging you're human, that we're all flawed. Anything else in this last minute here that we should leave listeners with? And that can
Uh,
come Amber and Karen,
Amber, you
either
go
one.
first.
Well, I'm so thankful, Karen, for the work that you do. I definitely want to be part of increasing the amount of conversations that we're having about our mental health and wellness here amongst ourselves in academia, and as well as our trainees that we're seeing. And I'm happy to report that we're going to be bringing mental health first aid training to our trainees very soon. So I'll be teaching that course to certify anybody who wants to learn more about mental health first aid and how they can impact the communities around them by having a better understanding of how to respond to situations. And I believe that that's going to spark more conversations about how we're doing and how our mental health and well-being is.
That's so exciting.
Mm-hmm.
And I would love to get more involved or be supporting you in what you do, Amber, or teach some of the thought tools that we use in coaching. I think it can be a nice complement, even if it's not directly designed for the treatment of mental health issues directly. But yeah, it sounds so exciting what you're working on.
Yes.
I would say my one thing I would like the audience to remember is just that you matter. Even if you have a crappy day, or even if you're not getting all the A+, like, you matter just for the person that you are and the life that you're building and doing your best. And just try to remember that. Try to treat yourself like it's true.
All right. Well, thank you both so much for your time. Really appreciate it.
Anytime. Thanks, Jeff.
Thank you.
All right. Thanks again to Amber and Karen for your time. We'll be sure to list some of the resources we talked about throughout the episode in the show notes, in the description of the episode, along with any other resources that are relevant for our trainee community that were not mentioned during the episode. Thank you all for joining. Thanks so much for tuning in to the latest episode of the Next Step podcast. If you liked what you heard, please share with other members of the University of Rochester community or anyone you think could benefit from these career stories. And we wish you nothing but the best in your own career journey. Until next time.